According to recent data from the CDC, the United States is in a mental health crisis, and it's affecting people of all ages. Crystal Flintrop shares how Winona State University is addressing this issue and giving students the tools needed to succeed.
There has been an increase of individuals facing mental health crises over the past few years, including here at Winona State University.
We all have different cultural orientations. Our parents sent us to college, and we're supposed to be successful. Our support system expects us to be able to handle whatever the world throws at us. We are being taught to be courageous, be brave, and more than anything else, to be okay, right? So we get to a point in our lives where perhaps we get in an environment where people give us permission to actually say, I'm not okay.
With this in mind, Winona State has been rolling out resources for students and staff to utilize in times of need.
We have a multitude of resources for mental health, starting with counseling services, which is highly utilized here on campus. And then we have the peer-to-peer support program, which I advise. So we have peer support within the residence halls. And then our health services department as well. They actually, in recent years, they see more students for mental health medication than almost any other appointment.
But what happens if there's a student in need after these offices close for the day? Or if someone is facing a crisis at night or on the weekend? Through the Minnesota State system, WSU has partnered with Mantra Health to offer 24/7 mental health resources to students.
Students can have up to 12 virtual telehealth services or telemental health services, so they can meet with a counselor virtually. They can also access 24/7 crisis, so they can contact a Winona State specific crisis line and be connected to a trained crisis professional.
So far, more than 150 Winona State students have signed into the Mantra Health app, with around 24 signing up for a therapy session. While this is a part of addressing the immediate problem, it's also giving these students the tools for life outside of college.
We're trying to get ahead of this, trying to help students develop coping skills. Is kind of topping the list right now because it addresses so many things that young people and adults and professionals, for that matter, are dealing with when it comes to trauma and trauma-related issues, and then when they first show themselves, and at what point are we comfortable talking about it.
At Winona State University, I'm Crystal Flintrop.
It's not just Winona State students that can use the Mantra Health app. Anyone within the Minnesota State system can use it. Since it's an app, you can use it anytime. Some students may opt to use it when they're on break. And students can even use it when they're studying abroad. And also, did I mention that staff is able to use this app as well?